Good morning. How are you doing? It's early in the morning, so I hope that everybody had already coffee. Because today we would like to be, energetic and enthusiastic about digital innovations. And the session is about enhancing care delivery through digital innovation, patient safety and staff well-being as guiding principles, organized by the European Patient Safety Foundation and Philips. So my name is Arthur Olesch. I'm a journalist from Berlin, and I would describe myself as a digital health enthusiast, but with a kind of objective view on the pros and cons of the digital transformation. And it's such great pleasure to be here again in Gastein. Last time I was here a year ago, and every time it's a wonderful conference. So digital innovation has incredible potential to transform healthcare, improve patient safety and outcomes. And I could go on for hours talking about the benefits of digital transformation, but there are, of course, a few howevers. And so while all IT systems or apps bring great advantages, it's healthcare professionals who need to learn, adapt, and use them at the end of the day. So while digital tools help personalize care, each click comes with the cost of direct communication with the patient. And data, of course, helps shift toward preventive healthcare, but clinicians must get through masses of often unstructured information stored in different sources. So a decade ago, I still remember that digitalization was all about benefits for patients. And it's nothing wrong about this, of course. But today we are thankfully also talking about the well-being of healthcare professionals. As you know, administrative overload leads to burnout and fatigue. So ironically, the tech is meant to reduce bureaucracy burdens, but often it's not the case yet. But there is a hope, and about this hope we will be talking today. This negative impact of technology can be changed, not just by improving existing technology or implementing new tools like AI, but also by rethinking patient pathways and focusing on the well-being of healthcare professionals. And this is just the topic today, how to balance digitalization for the good of patients and for the good of healthcare professionals, for doctors, for nurses. And we have a fantastic panel of experts today with us. And I will also ask you for your input and for your opinion. We will have some Slido questions, so get ready. The Slido questions are available for the audience on site and also online. I forgot to say hello to the online audience, but there are a lot of people following us from around the world. At the beginning, some house rules for the next hour. So please have your smartphones ready. You see already the Slido QR code, so please scan it. You can use the password, the keyword send, to enter the room where you will be able to vote for the questions. So you can also upvote the questions. There is an option that you can, if you just view all the questions already having submitted, you can just click, there is a small icon, you can click and upvote it, so it will get some voices and will be at the top of the list. With us is also Gergely Mikesi from Gastein, who will be moderating the Slido questions, and also he will be gathering all the questions from the online audience and from the on-site audience. And somewhere in the middle of the session, we will pick up the key questions from the audience, and I will ask them to the panelists. So yeah, During the Q&A session, we will also take some traditional non-digital questions, not from Slido, but from the audience on site. But we want to have this session democratic, so everybody has an equal chance to ask a question. So just use Slido. I think it's a better idea. And last but not least, we don't want it to be just another debate about digital transformation, about digital health, a debate that we have heard so many times, but we want to have a clear takeaways at the end of this hour that we have to that we have for discussing today's topic. So I will make myself comfortable right now, and it's time for our panelists to join the stage. First, Milka Tsikilova, General Secretary of the European Patient Safety Foundation. The foundation recently launched a campaign fighting fatigue to improve the well-being of healthcare professionals. Hi, Milka, how are you doing?
Good morning, Artu. I'm doing well. I'm a bit stressed, of course, but
we all are stressed a little bit.
But it's a great pleasure to be here.
The next expert is Mark Conrad, Head of Medical Affairs and Clinical Affairs for Hospital Patient Monitoring at Philips. So what I really like about Philips, and it's a very objective opinion, is its strong focus on user experience. So, for example, last year at one of the medical affairs, I saw something like a visual patient avatar. It's a kind of visual representation of patient vital signs that allows healthcare professionals to see all the critical data at first sight. We will talk about this later. So, Mark, how are you doing today?
Thank you, Arthur. It's great to be here. Thank you for having me. And also thank you for the kind introduction. So it's really great to talk about this, because I think, just like yourself, I'm a tech enthusiast. I really think we need to create a win-win-win situation, like you said, not just the patients, also the caregivers, but also industry, regulators, everyone. We really need to play together to make this happen and be successful.
Exactly, that's a good point. The next expert is Mikla Trumpikata, Vice President of the European Junior Doctors Association, an organization that represents the interests of 300,000 young doctors, European doctors. Hi, Mikla, how are you doing?
Hello, I'm doing fine, thank you. And it's very nice to be here, and I think it's very important that all of you here, you want to hear some junior doctors' opinions and experiences on the front lines. Thank you very much.
Thank you. And last but not least, Mark Lazarovici, Head of the Human Simulation Center at the Munich Medical School, a medical doctor and computer scientist. Mark is researching novel technologies like, for example, mixed reality, 3D teleconsultations, and simulating workflow disruptions, for example, in the operating room. It sounds already complicated, but you will explain what are you doing later.
Yes, good morning. Thanks for having me.
Good morning. So before we start our discussion today, we would like to have the first round of Slido questions and just to ask your opinion. So let's see the first question on Slido. Yeah, as you see, online audience is already voting. The question is, digital health applications, they contribute to the fatigue of healthcare professionals, they reduce the fatigue of healthcare professionals, or they are neutral regarding the fatigue of healthcare professionals. I did the same poll on LinkedIn a few days ago, and I'm just checking the results, and I'm really curious if they are the same as at the session today. So, okay, are neutral at the top, then they reduce, that's already a good sign, and contribute to the fatigue, 26%. We have 31 voices online. Okay, so let's wait a little bit. So I can already tell you what are the results of my poll on LinkedIn. So reduce, 64%. Have no impact, 15%. And contribute to fatigue, 21%. And I had 81 voices on LinkedIn. So it's kind of different. We have different audiences, but we have also different voices. And that is something that we would like to discuss also today. So we will come back to this question later, but let's switch to another question. The second question is, what is the most critical first step to ensure digital innovations effectively support healthcare professionals? So, improving digital literacy and skills, redesigning pathways and processes, improving the well-being of healthcare professionals, improving IT systems like efficiency, user-friendliness, interoperability, and introducing breakthrough innovations like, for example, AI. So, what are you thinking about the most important first step? So, redesigning pathways and processes, of course, that's a good sign. Improving IT systems. There is no option all above, but I think that would be the best option in this question. But we see that it's not about technology, but it's also about redesigning pathways, so about workflows, about how the technology is used and also applied in healthcare settings. And introducing breakthrough innovations like AI just at the very end. I've been reading recently a lot about this generative AI that is also introduced in the electronic health records, and they can, for example, summarize all the data or summarize all the outcomes. So it's an interesting option, and we will see how AI also can impact how doctors are using electronic patient records. But we're redesigning pathways and processes on the top, and I think that we can proceed to the last question. Can we have the last question? Yeah, which digital solutions should be prioritized in healthcare? AI applications reducing the administrative burden of electronic health records, apps for seamless patient-professional communication, telemonitoring and preventive health apps for patients, clinical decision support system, can decide on minimally invasive surgical system. So let's wait a little bit longer. 43 voices. So AI applications reducing the administrative burden of electronic health records. That's not surprising. There was a very controversial article in the New York Times with the title, "Why Doctors Hate Their Computers?" And it was all about the electronic health records that were basically developed 2 decades, 3 decades ago, and they are still the same, even the technology has changed a lot. So I think that the next step will be to redesign also electronic health records. And yeah, we have still on the tab AI applications reducing the administrative burden of electronic health records. So let's leave it like this. And if we can just leave this question and the result of the poll on the screen, because we would like to discuss them. A short question for all of you, because you didn't have chance to vote in Slido. So please answer with just one word: yes, no, or it's complicated. Do digital health applications contribute to the fatigue of healthcare professionals? Mika.
Well, I think we have healthcare professionals to reply in the first place, but I would say it's complex, yes.
Yeah, okay. Mark.
I would be blunt and say today yes, but I would want to ask the audience, because I'm actually quite surprised, how many care providers, clinicians do we have in the audience? Maybe just raise the hand. Oh. And then is that reflecting your perspective as well? We'll talk about that in a second.
Mikla.
Well, I would say still it's complex. Just like Mirka said, I guess that I'm always the person who says that we need more and more digital technologies in our work in medical field, but it's sad to say that currently what we have now as doctors and nurses are technologies that are not fully prepared for the work we do. So then it kind of contributes to the fatigue of us all in the medical workforce. But it's a fixable situation.
Okay, later on you will be still able to elaborate on that. So, Mark.
I tend to agree with Mark. It's for nowadays it's a yes, but it's fixable, as you say. So I do hope to see it better in the future.
Okay, cool. I would say no, but we will discuss it, of course. So first I will turn to you, Migla. As a young doctor yourself and the voice of young doctors across Europe, which digital health solutions should be on the top of the digital transformation agenda in healthcare, and what is needed so that digital health innovation support, not burden healthcare professionals? What's your opinion?
So as a junior doctor and as a doctor, I think, and anybody in the medical workforce would say that the biggest burden for us now is the non-clinical work, is the administrative tasks and any bureaucracy that we have to go through. So when we're speaking from that point of view, even though all the the newest technologies that are like AI ultrasound or telemedicine or anything like that are very interesting, and we're very excited about that, especially as junior doctors. Actually, junior doctors are the ones that are creating that usually, and they are the innovators in the healthcare system too. But as a general idea, only if we first use our collective experience and solve the administrative duties, problems, and everything that concerns paperwork and data collection and everything like that, only then, in my opinion, we can go further and go step forward. But then also another thing that is very important in, especially for junior doctors, and I think in healthcare altogether, is the education and healthcare literacy. So we can have any technologies that we want in any field. We can use AI, but if only those who are designing the tools know how to use it, and they are the ones who are trained to use it, then there's only, for the medical workforce, there's only added stress to the situation. So I think, and I know from a junior doctor's perspective, that not none, but most of the curriculums in medical field in Europe, they don't have that much digital technology literacy. They don't teach professionals how to use AI or anything like that. And especially when we're talking about continuous education in medical field, there's a lack of education in any digital technology there too. So junior doctors feel like they're coming to their works every day. They are asked to do a lot of stressful tasks that include clinical work, which is already very stressful. They don't have enough time for that. They don't have support and mentorship for that. Those are the other problems. And they have a lot of administrative tasks, another problem. And then added on that, they, like the worst scenario for a doctor is coming to work and suddenly a manager comes in or some administrative person and says, so today you start using this. Some digital tool, which would be great in another world, but I don't have the mental capacity for learning it myself. And I was never prepared. So that goes for junior doctors and any doctors and nurses, I think, altogether.
I think that another point is that we have forgotten a little bit how was it in the time when the electronic patient records were stored in papers, because of course the situation has changed since then. Yeah, so probably you don't remember the times with the paper electronic records, or you do. I don't know.
I do remember. I still I went through the change in my country. I'm from Lithuania. I went through the process of the change from paperwork to electronic paperwork. There were the worst times were in the middle, where we had to do both. So that I still don't understand how people survived that. I was a resident during that time. But then even now, when we have electronic health records, the problem is, which is very difficult to hear and understand probably when you don't go every day to clinical work, is that I have a problem with just this system which has too many buttons for me and too many tasks for me to do while I want to listen to the patient. So I don't have a problem to have help from electronic health systems or any digital tools. But whenever I try to use it, it usually either crashes, to be honest, or it's not designed for me, and it doesn't take my feedback. And that's the most important message for me today. That's why I wanted to talk today on the stage, is because I want everybody who are involved in digital technology creation for doctors and nurses and for patients to know that it's the most important thing to take the feedback and create systems to collect as much feedback from the frontline workers as possible. And only then you can create the technologies that actually help.
Okay, so we have already a consensus that it's better than it was before with paper files, but there are a lot of things to improve in the future, and the technology has the potential to improve things. So, Mark, question for you. Mark, yeah, I have to now, show which Mark. Question for you, because Migla told us already that, of course, systems, it's one problem, but are technological innovations alone to blame, or maybe mismatched workflows, inadequate training, low digital health literacy, also what was mentioned, or, why have systems doesn't support innovative solutions? What is the perspective, your perspective, because you are also researching workflows and how digital innovations can be applied in healthcare settings? Okay,
so that's a very interesting question, and I'm glad Mark is here representing the industry side, the creators of that technology, as you said. What I feel in both in my research field and in the educational work I'm doing is that there is a certain, how should I put that, a certain disconnection between what in research we envision as being helpful and what then in the end is being implemented. And probably this is due to, as you said, a certain background of these systems. They were developed a while ago, and now I know of many innovative systems that are very much closer to that what is envisioned in research. I think when you talk to researchers, they always say, yeah, and we can do process support. We recognize your gestures, and then we offer support based on your perceived competency level and stuff like that. And this is, I believe, very helpful at a point, but we're not there, because now we have a healthcare workforce that very much, as you said, is annoyed by the systems, which takes away time from doing the real clinical work, from talking to the patient, as you mentioned. And this gap, I think, is what needs to be recognized by both researchers and educators and the industry, the creators, and be closed. Because you can, of course, educate workforce in using bad systems, but that's not what we want to do. It's not so much. I would rather like to educate people in using helpful systems and showing, okay, this system is being designed for you. It can support you in this and that situation. Here is how to use it. Not, this is the system, as you mentioned. It has 1,000 buttons. You need to click the button 356 if you want that. Yeah, I can educate that, but it's not my goal. So I think it's really this gap between what's, from a human factors perspective, usable and what is implemented right now.
When I was 23, I remember I started my career working for an IT company that was developing IT systems for hospitals. And I know that our ambition was to make the systems as easy as possible, as user-friendly as possible. But sometimes it's impossible because you have to prepare so many options and you have to align with all the legislation. And so the ambition is there, but of course the gap between the ambition and real life is big. And that's why a question for you, Mark. I want to ask you about the recent report by Philips. It's a Future Health Index 2024. And what we can find there is that staffing is the #1 issue in healthcare. 92% of healthcare leaders believe that automating repetitive tasks is crucial for addressing staff shortages. 92% think digitalization and automation can save healthcare professionals time by reducing administrative tasks, and 89% say that digital technologies will allow healthcare professionals to perform at the highest skill level. So from the point of view of an industry, where are we now and what stands in the way of fulfilling this dream about digital technologies benefiting healthcare professionals?
That's a very interesting question, and you may be aware that sort of Philips has always tried to be a data company, data acquisition, data contribution, data migration, storage, always with a background of open ecosystem. And I think if we look in the past, and that is also true for the electronic medical records, that's for electronic digital tools that you've mentioned, and I liked your framing because you said, I was there at the transition from paperwork to electric paperwork, which is not a benefit. It's sort of the same. And that's what we've seen. So by creating isolated boxed solutions, we will always see industry coming from a device or a program, a tool, and innovate on the tool. We as Philips have always tried to play an ecosystem, be open in integration, integrate other partners into our system. And now, if you ask where industry is at, we're at the doorstep of something that really will enable a lot of, support for clinicians. So instead of in the past where we've always added, so we forced people in front of screens to serve more tools and enter more data into different tools and different tools. We are now at the doorstep where industry collaborates with clinicians on interoperability standards. So we now can sort of move beyond looking into the silo of the tool or the device to really sort of go the next step to what is the clinical need behind it and how can we try and tackle that across industry. So, for example, in our systems, alarming is a big issue. Vital sign monitoring, alarming is causing a lot of fatigue for healthcare professionals. The reason why we had so many alarms is because we did not give context to the alarms. Now we can integrate data from ventilators, from syringe drivers, medication pumps, all of that to contextualize the situation in which the patient is and give much more meaningful alarms. So that is what I see as the next step. And I actually look into the future with a very positive glimpse because exactly that is happening. So industry is collaborating. It's the first time that we go beyond our business cases and really try to collaborate even with competition, because we understand that that's what's needed from the care providers.
Mirka, as a multi-stakeholder organization, European Patient Safety Foundation, and having on board healthcare professionals, industry, patients, so how do you explain this slow adoption of digital health technologies? I mean, these good technologies, that are helping healthcare professionals in their work. When we had an interview a few weeks ago, you told me Europe's health workforce crisis is associated with massive fatigue among healthcare professionals, threatening their own safety and well-being, as well as patient safety and care quality. Yet the adoption of technologies that could potentially reduce the burden of healthcare professionals has been frustrating and slow.
European Patient Safety Foundation is an organization that brings together different patient safety stakeholders. So brings together the voices of industry, of doctors, of researchers, of organizations, patient safety organizations, national patient safety platforms. And we are in the middle. We are trying to understand their context and their problems and their issues, and trying to find where we can align ourselves, where can we do things together, and how can we together improve patient safety. And this is from European perspective, but also from the national perspective. From our point of view, it's really important to understand reality of our stakeholders, our affiliates in their daily life. And that's why I'm extremely happy already, because we have what we try to say. We have our representatives here saying that out loud. So this brings us to kind of try to understand what are the barriers for technical innovation and to bring it. And we hear there is lots of investment and there is a huge potential. But there are barriers like infrastructure that is outdated in many hospitals. There are previous experiences from missed opportunities where innovation and technology was not correctly implemented or developed according to the needs. And this all creates a lot of frustration on the side of the healthcare professionals, but also on the side of the industry, because they see what could be done. But it's really slow, and the healthcare professionals are not using the tools, maybe for 20%, because they didn't learn how to use it. So we identified as one of the key problems and key issues, fatigue being one of the causes of these problems. There are others, but fatigue is one of them, and chronic sleep deprivation, and we don't talk enough about it. And we started last year a collaborative campaign, Fighting Fatigue Together, and I'm really happy to be in Gastein 1 year later, because last year we received a European Health Leadership Award for this campaign, and we are still working very actively in different countries and raising awareness about the impact of fatigue and chronic sleep deprivation on healthcare professionals, but also on patient safety, on patients, because they are dangerous. When they are tired, they can create harm. But this harm will then also be very dangerous for them, because we have second victim syndrome, and it's the whole complex problems that are created by not thinking about the healthcare professionals' well-being and safety and eliminating their fatigue. So we are convinced, first we need to start thinking about people, about patients and healthcare professionals using the tools, putting them in a condition when they are able to think, when they are not super tired, when their performance is limited because they were not sleeping for I don't know how many hours, and put them in a condition when they will be able to think about redesigning processes. Because bringing a new tool in the system means that they will have to work differently. And when you already count your minutes because you need to see your patient, and when you need to encode, I don't know how many times, the same record. And you still should think about being more efficient and work in a different way, redesign processes. That doesn't work. And we are convinced this is one of the main barriers why the uptake of technology and innovation is so slow.
what I liked about the campaign Fighting Fatigue. I remember one slogan was, "Fatigue is not a part of the work." So it was fabulous.
Yes, that's what we say. It's not meant to be part of the work. And we have two others. One is when we talk about the accidents on roads, because healthcare professionals, driving home after night shift, being super tired. And we say also that taking risks with your own life is not meant to be part of your job. And the last message that we say, that taking risk with your patient because of fatigue is not meant to be part of the job. Healthcare professionals, they don't go to the system to harm patient, and we need to do everything possible to prevent that.
Okay, so let's take some questions from the audience. Gergely, what is the online audience and on-site audience talking about or asking about?
Yes, thank you. We have several questions, which is very good. But for first, I would like to ask you to please give me some answers to the audience. That the second poll, jump back please to the second poll, is to show that the introduction of AI technologies is not a priority. Is this the last one on the list?
Yeah.
But on the third poll, we saw that AI application can reduce the administrative burden of electronic health records. And this is which digital solutions should be prioritized in healthcare. And can someone comment on this contradiction?
Yeah, that's an interesting question, of course. As I said at the beginning, there are already a few systems that are applied in the US that are helping to summarize all the information in the electronic patient record, generative AI systems. And of course, we are at the beginning of the AI revolution. There is a lot of hype around them. So, Mark, I guess it's a question for you.
Yeah, maybe. Obviously, I noticed this contradiction. I was prepared to comment on it. I think there are two things here. First, there is probably a sort of tiredness with the hype, and whenever you see, well, will AI be a solution? You say, yeah, I heard that. Probably no. That's why it might got ranked down there. On the other hand, when you ask a very concrete question, like, could AI help you summarizing patient records, doing stuff like that, do you think, yeah, probably yes. So I think the contradiction comes from partly the general versus very concrete question. And to be honest, it might also be a sort of, I don't know how many of the respondents used those tools or not. I've been obviously using them for a while, and in limited domains and with clear tasks, the performance is impressive. I would still be a bit cautious because, and I don't even want to open that box, but there is a huge topic of ethics behind this. Do I put my patient records into a machine, the data goes somewhere, something happens to it, no one knows exactly? That's one thing. And the other thing is, what are the pathways leading to the summary? So can I trust that summary or not? On the other hand, can I trust my fatigued colleague to give me a handover summary and not forget some details? So this is not saying AI is necessarily worse than anything else. It's just we shouldn't just say, well, that's the perfect future. I think there is a lot of development potential here. I think used in well thought through fields of application with a clinical background where you recognize the need and propose a tool. And you mentioned the open or transparent ecosystem, making it clear what really happens behind the scenes. That will help and will go into good AI tools that will help people. So it will get up from down there.
Thank you. Do we have more questions from the audience?
Can I comment on that just quickly?
Yeah, sure. Yeah, please.
Because honestly, I think that there is a few things where I stumble a little bit. So first one, I don't see much of a contradiction. I have problems, for example, with the breakthrough AI. AI is a tool, is a screwdriver. We use the tool to get to a result. The tool is never going to be the breakthrough, the first step that's going to sort of heal the world. So AI will be there. AI is going to be part of the story, and it will be a tool that will be used. But ideally, that's what we have to change, and that's where the contradiction resolves. We have to change how our clinical colleagues work. We have to change the pathway. So we have to enable them to go back in front of their patients and have AI do the tasks in the background that now they're forced to do for billing reasons and other things.
I don't want to go deeper into the discussion about AI because, of course, it's a huge topic. But Mark, you have already started. So one short question. How do you see at Philips this development of generative AI? Because AI we have been using already for years. What is about generative AI? Is a game changer, or it's another tool the same as the AI algorithms that we used before?
I think it is changing the game. It is an incredibly powerful enabler for a lot of things, but it's not a revolution. It's an evolution, and we have to be very considerate how we do it. One example, I think Migle had mentioned it as well, is training and usability. Extra tools is extra burden. If you buy a ventilator, a bedside monitor, an extracorporeal life support machine, you get instructions for use of about roughly 1,000 pages. Nobody's reading that. Now with Gen AI, for example, we can alleviate that. You are next to the device and say, how do I turn you on? How do I check your alarm system? How can I make sure that you are properly serviced? And then you get the results that you need on the spot. So we actually go into an educational, collaborative way of engaging with technology. And I think that's where generative AI is really making a difference.
So even talking about these breakthrough innovations, we have to go back to the questions about workflows, about digital literacy, about training. So that's the point. Do we have more questions from the audience? We have time for one more question.
Okay, then there's one more question. We just see on the screen again that according to the audience, the most important first step should be the redesigning the pathways and processes. Can you give us some examples about it? How the digital tools better fitting in the healthcare pathway, or can give answers in it?
Mirka, do you want to comment on that?
I think there are other panelists that are better equipped to reply. I can speak from the general point of view. We can involve stakeholders, and we can first think about the process, how it could be, and then adapt and use this amazing technology to serve to this system. So I know that there are many different, there is a telemedicine, for example, that will definitely is redesigning processes, because we need to speak with the patient that is at a distance, or we speak with healthcare professionals that we can train them at a distance. So it is redesigning pathways and processes. The main problem or main issue here is that we need to take our time to think about it first, not just, okay, now we have a problem, let's quickly fix it, and then maybe there is some solution, we bring it in, and then, we created new problems, and we even don't know about them because our staff is not able, doesn't feel safe talking about them. So my point is that there is a huge potential for redesign, and it's going on. There are many healthcare facilities working differently, and that's another point. We don't know about them, and every single healthcare facility or country is trying to do their own little invention, and then there is not enough of sharing best practices and collaboration where we could accelerate this exchange. But if we take our time, and if we think well about how it could look like, then the technology can really help us.
Gergely, thank you very much. I will now ask questions about, how to use digital technologies. Migle, I want to ask you a very provocative question, because young doctors are digital native. So I guess that you don't have problems with using Facebook or Instagram, but when it comes to systems in healthcare settings, there are some already, gaps in UX, user friendliness, and user interface. So you're familiar with breakthrough innovations, with social media, with all this stuff like smartphones. So how does the younger generation of doctors view basically new technologies in healthcare? So what are you hoping for? What's worrying you? And why other technologies, not healthcare related technologies, are much more easier and like that the technologies in healthcare?
Thank you for the question. First of all, I want to say, Mirka, you're a better advocate for doctors than I am, probably. This is amazing to hear all this and from everybody. I have to say, yes, junior doctors are native in any digital technologies. But what you just said, that was just about interface, right? That it's different than like Instagram and what we're doing in the hospital. And it's not just interface. Basically, the usage of digital technologies in healthcare, whether it's some applications, electronic health records, triage systems, or ventilators or anything like that, AI especially, what you talked about here, is very different from any other technology. So when we're talking about junior doctors, yes, they grew up with technology, and that only allows them to understand better when they come into work that the technology that they have there and digital solutions that they are provided by their managers, administration, everything like that, is not ready for medical workforce, is not really helping, and sometimes is disturbing the work. So now I'm painting a very dark picture here. So it's not every time like that. But when we're talking about slow adoption of digital technology in junior doctors' population, that is exactly one of the reasons why it adds up the stress and fatigue, because juniors understand what it could be. And when I'm not at work, or any of my colleagues are not at work, we see a lot of great solutions in the world, digital solutions. And we see how user-friendly they are, how simple they can be. Like anybody can use it. And then professionals who are trained for 10 years or more come into their clinic every day and they see that the same things do not apply. So maybe sometimes it's because of the policies that we have, because there are a lot of regulations, and maybe it's difficult sometimes to make it easy to use. But we understand that it's not always the case, and there's just lack of investment in what we need. So the managers and the policymakers, they put on regulations on you, and they put on tasks for you, but they don't finance it enough to make it user-friendly. And then it adds the pressure on junior doctor and any doctor or nurse. And then, of course, it leads to the burnout and the fatigue and its general poor working conditions, especially when you see that outside of the hospital is much more different and anything is possible. So that's the difference. And when you asked about the training, so in my opinion, and I think that all the junior doctors agree, that healthcare technology has very specific rules, has to have very specific rules and standards, and has to take a lot of feedback from us. And when we don't feel that is happening, and we don't have the curriculum during our training, and we don't have the teachers, because nobody was taught to use it, so nobody can teach us. And we are continuing teaching ourselves, and we understand that it doesn't happen outside the hospital in any other workplaces, then we get even more frustrated.
We have 10 minutes more, so Mark, a question for you. There are already fantastic technologies that are good for the good of healthcare professionals and patients. Can you give us some real-life examples from your work? What is new? What is new in research on digital technologies? I mentioned at the beginning that you are working on some kind of simulations, on 3D teleconsultations. So can you give us some kind of positive example of these good technologies?
Okay, I see your point. It's to put it in a more positive perspective. I will maybe present a few or talk about a few technologies that are not so much going into what you might do. I found the idea of the talking ventilator genius. Honestly, I would love that machine. or any talking device that helps me use it. But that's his idea, so I'm not going to talk about that. Where I do see a great potential of technology is in telemedicine was mentioned. And I think telemedicine nowadays is, okay, you have a camera pointing maybe at the patient. It's a huge tower that you walk around with. But on the side of the teleconsultant, and the guy who looks at the patient, that's a very, very limited experience. It's like watching a television with one quarter of the screen being the patient. It's nothing near being close to the patient, and that's where I think, and where also part of my research is going to that. That's why I'm talking about it. That's where I think we can get to a point, not tomorrow, surely, where we have sort of a holodeck from Star Trek, where you're really there and see the patient, and the interaction with the colleagues who are local is kind of like this. You see them and you can interact in a natural way. And the technology is in a very early stage, but we've conducted also some studies of acceptance with clinicians, trying to see how they perceive this. And the results were, let's say, encouraging, where they all mentioned where the technology fails or has limitations, because they know it. They have comparisons. They said this would be really helpful to bring in a colleague from outside, from wherever, and be at the patient. It's not you get called during the night, someone is asking you something about a patient, then maybe you need to log into your computer to go to the patient record to check. This could give both parts a better experience. So this is maybe an example of a good technology. And very briefly, another one would be in training, where the talking ventilator could be supported by, let's say, augmented reality things like highlighting stuff, or you look at it and you see the button becoming red or something like that. So maybe augmented reality combined with artificial intelligence could help overcome training issues, complex machines that are hard to use. So these would be examples that I could see in the future helping the professionals.
So, of course, the next question is for Mark. When we talk about technologies, there has been a significant progress in the user experience of technologies over the last 2 decades, 1 decade. And at the beginning, I also mentioned this visual patient avatar by Philips. Can you give us a short overview of how digital technologies have been evolving over time and getting more and more patient-friendly and also healthcare professionals oriented? So maybe you can also give us some examples from Philips.
Yeah, let me sort of start with this patient avatar. And we've just heard from Mikkel, we're not there yet. So we're not good enough in creating our user interfaces. And that is, I believe, for monitoring, the avatar is a milestone. It really is a milestone, because we've done something completely different. In the past, we've added colors, we've added complexity, we've added more, we've added more. Now, the avatar is the first step, and that's what I meant before, where we're trying to turn around and do the opposite. Remove, simplify, have less, and have it easy to understand. We get sometimes pushback from clinicians that say, anybody can understand this. I don't have to be an anesthesiologist. And we're like, yes, that's the plan. You don't have to have a burden. You can be an anesthesiologist on other stuff, not on realizing the situation. So I think that's crucial. The way it was created is crucial because that was a very close collaboration with clinicians. The inventors have started their pilots. Anesthesia is often compared to flying. So they're pilots, and they said, why do these dashboards in the plane improve over time, over and over? And they so easy to understand now compared to 10, 15 years ago. Why can't we replicate that in anesthesia and intensive care? And that's where it all started, and sort of creating this really simplified way of understanding the situation and be aware of what's going on. Give you another example where I think we have a very interesting short to mid-term innovation at hand. We spoke about the ecosystem. We spoke about the open integration, the interoperability of devices. This year at HIMSS, we've showcased a silent patient room. So we spoke about alarm burden. Roughly 10% of the alarms that go off in an ICU are actionable. 90% is noise. Nevertheless, where is the alarm going off? Next to the patient in the ICU. Are we expecting that patient to turn off the alarms or to act on vital sign deviation? This is sort of impossible. So we've created a funnel. We've bundled all devices and externalized the sound out of the room. So the patient's not getting any sound. The family's not being anxious because there's alarms going off all the time and nobody's coming and responding because they can see from the central station it's only noise. So we remove that stress, we remove that burden, and we delegate the alarms to where they need to go to the caregiver, to the nurse. If the nurse cannot respond, we delegate it to another nurse. So there is a safe propagation of the notification, the alarming, and if the system fails, it goes back to standard requirements. So we've managed, even today, so it's showcased today, that we can remove all alarms, and the nurse has not to respond to 3 different devices going off. There's one device going off. The ventilator is silenced, the syringe drivers are silenced. The only engagement is reducing 5 screens to 1. And I think this approach of really trying to simplify and to have less engagement with technology for doctors, for caregivers, for nurses, that's the way to go. And that's at hand, I would say.
We have only 2 minutes left, so the last question for you, Mirka. To sum up the discussion, we will still have 1 minute for the final takeaways. By Mirka, you are representing European Patient Safety Foundation. So from your perspective, what key opportunities in digital innovations are being overlooked regarding patient safety? So how can we better use technology to improve patient safety?
I think the key point is to switch the focus. We need to change focus from technology saving our healthcare system and to focus on patient safety and safety of healthcare professionals. Because when we first identify priorities from the patient safety point of view and healthcare professional safety view, our decisions will be different. We will choose different priorities, and we will stop with the fixing short-term problems, and we will start working on safe system for everyone from a long-term perspective. We will to be able to do that, we need to work in collaboration. We need to bring the voices together, and on different levels. It can be a state level, but also hospital level, and decide about the priorities. And we need to also be open to listen to these priorities, because this maybe first priority we should really start working at is communication, teamwork, and then fatigue. And this will bring us to a different perspective, and from that we can start then afterwards identifying other problems that are causing harm to the patient, harm to the healthcare professionals. And if we start using technologies and investing in preventing these, we will also bring significant savings in the system. We know that there is a research that supports that if we invest in long-term sustainable patient safety improvement, we will save the cost. And then we can reinvest the cost. We can start redesigning processes, and we will start, thinking long-term. So I think one of the key points is to stop with the short-termist, as I said in the article, and think at the patient safety as a guiding principle and bring us to the long-term solutions.
So it's time for a short wrap-up of the discussion. One sentence, Eva, to you, just one sentence. If you could pick up, call to action to make technologies work here and now for healthcare professionals and patients, what it could be? Mirka, one sentence.
So dedicate time and take it as one of the investments. So think about time that needs to be allocated for development, decision making, and then proper implementation of technologies.
Konrad. Mark, sorry.
I would lean on what you said before. It's buddy up. We need policy making, legislation, industry, and caregivers. Buddy up, solve the underlying true needs of what the problem is, instead of really focusing on devices, technology, patches, and short-term revenue.
Mikla.
Well, I would have to agree that there are different levels on which we have to have some standards on how we implement, how we search for the technologies we need and how we implement that. And the key part in that is, I'm very happy to hear that from you, is to take feedback from medical professionals on every step of the way, what would help them to provide patient safety and quality of care.
Mark.
Well, as the collaboration aspect has been extensively covered, I would say let's make technology transparent, so easy to use as a pen.
Mirka, Mark, Mikla, Mark, thank you very much.